Ready for a deep dive?
Let's do it.
Buckle up, because today we're diving headfirst into the world of pharmaceuticals.
Sounds intense.
Wow. It kind of is, but also super fascinating, you know? You guys sent in some info on the most commonly prescribed medications.
Yeah.
And we thought, hey, why not break them down?
Like decoding those mysterious labels on your medicine cabinet.
Exactly. So we're going to be taking cues from Dr. Khalid Hassan's podcast. He did this whole series on the top 200 most prescribed drugs. Super interesting stuff.
Yeah, even if you're not a doctor or pharmacist, just knowing a bit about these meds can make you a more informed patient.
Right. Like you can actually have a conversation with your doctor, understand what they're saying.
And maybe even impress your friends with some random pharmaceutical knowledge at your next trivia night.
Okay, so where do we even begin?
Well, Dr. Hassan's list is alphabetical.
Which, makes sense for a list.
But to actually make sense of all this, we thought, hey, let's group these medications by what they do.
Yeah, like what they target in the body.
Exactly. So we've got everything from anticonvulsants for seizures
to fibrates for cholesterol.
The whole shebang. So I guess the best place to start would be with meds that target the nervous system.
Right.
Okay, nervous system. What jumps out at you from that category?
Well, one that's pretty common is gabapentin. You might know it by the brand name Neurontin.
Neurontin, okay.
Yeah, a lot of people think it's just for seizures.
Right, that's what I thought too.
But actually, it's super helpful for managing nerve pain.
Oh, really? Like what kind of nerve pain?
All sorts. Think diabetic neuropathy.
That's the one where you get tingling and burning in your hands and feet, right?
Yeah, exactly. It can be really debilitating. Gabapentin can also be prescribed for shingles pain.
Wow, so it's pretty versatile.
It is.
That's interesting.
And while we're on the topic of meds that affect the brain, there's another one that's Granisetron. The brand names are Kytril and Sancuso.
Okay, I haven't heard of that one. What's it for?
It's an antiemetic. Basically, it prevents nausea and vomiting. Oh, like those patches people wear after surgery.
Precisely. It works by blocking serotonin receptors, which are kind of like the triggers for those yucky feelings.
Makes sense.
But here's the thing. Granisetron isn't just for post-op nausea. Nope. It's also used to prevent nausea and vomiting caused by chemo.
Oh, wow. That's really important.
Absolutely. And it can even help with motion sickness. So, yeah, pretty versatile.
Wow. Okay, so we've covered a couple of meds that affect the brain. What about something, I don't know, maybe with a bit more weight behind it?
You thinking about haloperidol? That's Howal, by the way.
Yeah, Haldol. It was actually listed twice in Dr. Hassan's podcast, so it must be a pretty big player.
You could say that. Haldol is an antipsychotic.
Okay.
It's mainly used to treat serious mental health conditions like schizophrenia.
So pretty heavy stuff.
It is. It helps manage hallucinations and delusions, which can be incredibly distressing.
Makes you realize how essential these medications are for people dealing with these conditions.
Absolutely. It's about improving quality of life. All right, ready to switch gears a bit?
Sure, what's next?
Let's move on to meds that target the heart and blood vessels. Lots of interesting stuff in there, a real mix of old and new approaches.
Oh, like what?
Well, we've got Hydralazine, one of the older blood pressure meds. Brand name is Apresoline. It works by widening blood vessels, which helps lower blood pressure.
But I guess there are probably newer options now, right?
You're right, there are. While Hydralazine is effective, newer medications tend to have fewer side effects, and they don't interact with other drugs as much.
Oh, I see.
So in terms of newer options, there's Irbesartan, that's Avalide, and Losartan, also known as Hyzaar. These are both what we call angiotensin II blockers. They work by blocking a hormone that normally causes blood vessels to narrow.
So that helps to relax the blood vessels and lower blood pressure.
Exactly. And then there's the trusty old diuretic, Hydrochlorothiazide, or HCTZ for short.
Oh, yeah, I've heard of that one.
Brand names for that are Aquazide, H, and Microzide. HCTZ helps the kidneys get rid of excess water and salt.
Which also lowers blood pressure.
Right, and it can also help reduce swelling. What's interesting is that it's often prescribed alongside medications like Irbesartan or Losartan.
A two-pronged attack on high blood pressure.
Exactly. Teamwork makes the dream work, even in the world of pharmaceuticals.
So true. Okay, so we've talked about meds for the nervous system and for blood pressure. What else is on the list?
Well, we've got a trio of meds that tackle diabetes. Glimepiride, Glipizide, and Glyburide. The brand names are Amaryl, Glucotrol, and DiaBeta, respectively.
Okay, so 3 different meds, all for diabetes. Why so many? Isn't diabetes like just diabetes?
Well, not really. Diabetes is a complex condition, and people respond differently to different meds. Some people might need their pancreas to produce more insulin, while others might be more sensitive to certain side effects.
So it's about finding the right medication for the individual.
Exactly. It's all about personalized treatment.
That makes a lot of sense. Okay, what else have we got?
Let's talk about Gemfibrozil, shall we? The brand name is Lopid, and it's a fibrate that helps lower cholesterol.
Cholesterol. That's a whole other can of worms.
It is, and it's not. Let's talk about Gemfibrozil, shall we? The brand name is Lopid, and it's a fibrate that helps lower cholesterol.
Cholesterol. That's a whole other can of worms.
It is, and it's not just as simple as good and bad cholesterol. Gemfibrozil specifically targets triglycerides, which are a type of fat found in the blood.
Okay, so what's the problem with high triglycerides?
Well, they're a risk factor for heart disease, so lowering those levels is really important for maintaining good heart health.
It's kind of like clearing out the plumbing to keep everything flowing smoothly.
Exactly. And speaking of clearing things out...
Uh-oh, where are we going now?
Don't worry, nothing too gross. Let's talk about Guaifenesin. You probably know it as Robitussin.
Oh, the cough syrup.
That's the one. It's an expectorant, which means it helps thin the mucus in your airways, making it easier to cough up.
Ah, the sweet relief of a productive cough.
Exactly. Okay, ready for one last medication?
Hit me with it.
This one has a pretty unique story. It's called hydroxychloroquine. The brand name is Plaquenil.
Plaquenil. Rings a bell, but I'm not sure why.
Well, it was originally developed as an anti-malarial drug.
Ah, that's it.
But it's also used to treat autoimmune diseases like rheumatoid arthritis and lupus. It basically helps modulate the immune system, reducing inflammation and pain.
Wow, so one drug can have all these different uses. It's pretty amazing when you think about it.
It is. It really highlights the complexity of the human body and how much we're still learning about how medications work.
So true. Well, I feel like we've covered a lot of ground today. We've talked about different drug categories, how they work, and even touched on the importance of personalized treatment.
It's been quite a journey through the world of pharmaceuticals.
Definitely. But it's important to remember that this is just a starting point.
Always, always consult with your doctor or pharmacist for personalized medical advice. They're the experts, after all.
Absolutely. And a huge thanks to Dr. Khaled Hassan for his amazing podcast, which really inspired this whole deep dive. Now, for our listeners, here's something to ponder. With so many medications out there targeting specific conditions, what does the future hold for drug development? Are we moving towards more personalized medicine? Or are there entirely new approaches on the horizon? It's a fascinating question to explore, and one we might just dive into another time.
Sounds like a plan.
Until then, stay curious and keep those medicine cabinets organized.
And don't forget to read those labels.